Real news for Americans 50 plus. This is Emeritus News Channel.
Good afternoon. Over the past 15 months, Secretary Sebelius and I have made it a top priority for both of our departments to crack down on healthcare fraud, which we know costs taxpayers billions of dollars every year. Through our Health Care Fraud Prevention and Enforcement Action Team, better known as HEAT, we have brought the full resources of the federal government to bear against individuals and against corporations who illegally divert taxpayer resources for their own gain. Today we are here to announce the latest results of that effort. The pharmaceutical company AstraZeneca has agreed to pay $520 million to federal and state taxpayers to settle claims that it illegally marketed the antipsychotic drug Seroquel for uses that were not approved as safe and effective by the Food and Drug Administration. Now, as part of this scheme, AstraZeneca was accused of illegally promoting Seroquel to physicians and violating the federal anti-kickback statute, all in furtherance of supporting the drug's use for a host of illnesses for which it was never approved. Now, according to the settlement, AstraZeneca's illegal marketing of the drug led to millions of dollars in false claims against federal and state programs like Medicare and Medicaid. These were not victimless crimes. Illegal acts by pharmaceutical companies and false claims against Medicare and Medicaid can put the public health at risk, can corrupt medical decisions by healthcare providers, and take billions of dollars directly out of taxpayers' pockets. Now, as we have said, we will not let such actions stand. This administration is committed to recovering taxpayer money lost to healthcare fraud, whether it's by bringing cases against common criminals operating out of vacant storefronts or executives at some of the nation's biggest companies. The settlement that we are announcing today is a major accomplishment in that effort. It is the largest amount ever paid by a company in a civil-only settlement of off-label marketing claims. The federal government will receive $302 billion, and states will share up to $218 million. Over the past 15 months, we have recouped nearly $2.8 billion in healthcare fraud cases through use of the False Claims Act, money that will be fed back into the federal coffers. In 2009, the Justice Department also reached an all-time high in the number of healthcare fraud defendants charged, with more than 800 indictments and more than 580 convictions.
And let me make it clear what happened in this case. AstraZeneca paid kickbacks to doctors as part of an illegal scheme to market a drug for unapproved uses. They marketed the drug to the elderly, to children, to veterans, to inmates. And they bilked Medicare and Medicaid, the Defense Department Health System, the Veterans Department, and even our Department of Corrections. And what they did endangers patients and drives up health costs. And it's a perfect example of why the administration is determined to crack down on healthcare fraud, no matter what form it takes. A little less than a year ago, as the General said, the Task Force HEAT was created, and it brings together the top officials from our two departments so we can share information, spot trends, coordinate strategy, and develop new fraud prevention tools. It's changing the way we fight fraud, helping us be nimble and creative, just the same way the criminals act who we're targeting. So I encourage all of you to stay tuned for some new regulations that our department will be announcing as part of that law in the next couple of weeks.
This investigation and the settlement that we are announcing today would not have been possible without the cooperation of our state and federal partners. U.S. attorneys across the nation, the HHS Office of Inspector General, the U.S. Postal Service Office of Inspector General, the FDA, the National Association of Medicaid Fraud Control Units, state attorneys general from around the country, and the talented lawyers in the Civil Division at the U.S. Department of Justice all worked incredibly hard to bring this matter to a successful resolution. I also want to commend James Wetta, the whistleblower who brought this case to the government's attention, as well as other whistleblowers who have brought to our attention many other cases. And successful collaborations like this one aren't just limited to the Justice Department's fight against healthcare fraud. That interagency, federal and state commitment extends to other areas where we are also tackling fraud on the taxpayers. In November 2009, President Obama elevated the battle against financial fraud to a cabinet-level priority by asking the Attorney General to chair the Financial Fraud Enforcement Task Force. The increased enforcement efforts aimed at addressing fraud in the housing and mortgage industries have increased recoveries in this arena from $15 million in 2008 to $52 million in 2009 and the first part of this year. Our commitment also extends to rooting out fraud in connection with the procurement of goods and services used by our military and civilian agencies, including fraud that affects our men and women fighting in Iraq and Afghanistan. Since January 2009, procurement fraud cases have accounted for approximately $630 million in recoveries, over 3 times more than the Department's recoveries in 2008. Investigations into other alleged wrongdoing in connection with procurement fraud are active and ongoing. And we've also increased our recoveries in government grant fraud cases from $14 million in 2008 to $104 million since January 2009. In total, in the past 16 months, as the Attorney General mentioned, the Civil Division, standing side by side with U.S. attorneys and state attorneys general across the country, has obtained over $5.7 billion in civil fraud settlements and judgments, criminal fines, penalties, restitution, and forfeitures. Civil recoveries alone have topped $3.75 billion, and criminal recoveries from the Civil Division's Office of Consumer Litigation criminal cases have amounted to close to $2 billion. And yet, even with all of our success, we know there is still much work to be done. With the help of our law enforcement partners gathered here today, I'm confident that we will continue to do all that we can to protect taxpayers and consumers against fraud, waste, and abuse.
Attorney General Holder, Secretary Sebelius, Assistant Attorney General West, thank you for the kind words about our office. Your thanks should not be addressed to me. However, they should be addressed to the hardworking people who actually did the work on this case. My first Assistant United States Attorney, Virginia Gibson, Assistant United States Attorney Colin Cherico, Auditor Dennis Cook, the hardworking agents from Health and Human Services and Postal Inspector Generals, and the hardworking attorneys from the HHSIG. Each United States Attorney's Office focuses upon the health care fraud that it finds in its district. In the Eastern District of Pennsylvania, we have had great success pursuing pharmaceutical companies that have defrauded the government through kickbacks and off-label marketing. In the last 5 years, this office has recovered more than $4 billion for taxpayers from pharmaceutical companies that cut corners and did not play by the rules. AstraZeneca used its sales force to pressure doctors to prescribe Seroquel for purposes that had never been approved by the Food and Drug Administration. The FDA only approves drugs after they have been rigorously tested to ensure that they are safe and effective. By pushing Seroquel for unapproved purposes, AstraZeneca made patients into guinea pigs in an unsupervised drug test. Today's settlement puts a cost on such misconduct. Thank you.